episode 48. This is the Inside Deschutes County podcast. Wherever you might be and however you might be listening, thank you for making us a part of your day. You can subscribe on any podcast platform. You can also find us at deschutes.org/podcast.
Deschutes County is an amazing place to live,
Ease of access,
work, and play.
Great place to raise a family.
I love the weather and the high desert.
At Deschutes County, we provide excellent service.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
Welcome to the Inside Deschutes County podcast. We're so glad you're with us. I'm Eric Breon. Well, in this episode, we're joined by Deschutes County Health Officer Dr. Richard Fawcett and Public Health Director Heather Kaisner to talk about a topic that's been making some headlines recently, the measles. Thank you both for joining us.
Thank you for having us. Excited to be here.
Thank you.
Well, there's some stuff going on with the measles, some outbreaks, parts of the U.S., Texas, some questions on the rise, maybe. We just wanted to dig into the facts with you and how we can protect ourselves and our community. So let's start with the big, easy question. Dr. Fawcett, I'll hit you with this one.
All right.
What is the measles? How come it's coming back? Why are we hearing more about the measles?
Yeah, the measles is a very common viral infection. We hear about it causing infections in kids, very highly contagious viral infection, I guess officially called rubeola. And it's one of the most contagious pathogens that we know of in medicine. It has a very distinctive presentation in terms of symptoms and signs. It's, however, been less prevalent, in the U.S. and at one point back in like 2000 was declared eradicated. But so I think a lot of clinicians are not as familiar with it as they probably were, 40 years ago, for instance. It's a infection that tends to start with high fever, and then this collection of symptoms with cough, runny nose, and conjunctivitis or kind of red eyes, the 3 C's, cough, coryza, and conjunctivitis, red eyes. And then a rash, a very distinctive rash that develops maybe 1 to 7 days after the first symptoms, which is one that starts almost always on the face or maybe upper neck and then spreads throughout the body.
That's kind of what people think about, right? The rash and measles.
For sure.
And I think, though, it's important to realize that it starts off where some people might just think they have the common cold. So you're contagious.
Why is that with all these things? It's like the common cold things. But then there's something else that kind of sets it apart, right?
Right. Well, I think with measles, the fever is really quite elevated. It can be 105. And I think it goes on for a little bit longer. When you think you're getting better with this prodrome of the cough and the runny nose, red eyes, then you get a rash and you still feel poorly. So it probably goes on a little bit longer. It's a little bit more severe, higher fever than just the common cold. So
definitely.
People like to wait and hope that it's just going to be the cold and it'll be gone in 3 days. But, if you're watching your kids and they're still coughing a lot and having fever and then they get this rash, I think it's something more than just the cold.
So Heather, why am I bugging you to be on this podcast now? So it's popping up, right?
It is popping up.
Outbreaks, Texas, is that kind of where the majority of this is right now?
Yes. We are highly concerned in public health right now because, as Dr. Fawcett mentioned, back in the 2000s, we thought we had mostly eradicated measles. Cases would pop up, but usually from international travel. And now within the U.S., just this year alone, we have over 600 confirmed cases of measles, which I think it's important to realize compared to last year, we had 285. And the year before, we only had 59 cases.
Jumping.
So we are not, we're just out of the first quarter of the first part of this year. So huge concern. And as you said, the majority of these cases, about over 490, are in Texas right now in a very large outbreak. And unfortunately, we've had 2 child fatalities, which is tragic and completely preventable. So it is on the top of our mind here in Deschutes County and want to prevent that from happening here.
And what's the situation in Oregon?
No cases in Oregon
Okay.
as of right now.
But close by.
Yeah, there is cases in
California,
Washington and California, not outbreaks at this point. But, measles is the most contagious disease out there, and we need really, really high vaccination rates to keep it away.
And how does this spread? It's
Well,
mostly airborne, right?
It's airborne. It's airborne. It's highly contagious. There's studies that have shown that the virus can remain contagious and active for up to about 2 hours just in the air on surfaces. Data is suggesting that one person can infect about an average of 10 or more people who are vulnerable, maybe unvaccinated or under-vaccinated. So it spreads very easily. And this droplet spread in the hospital situation, because of it being airborne and active in the air for a while, we usually have people on the highest level of isolation called airborne isolation. So it's really, really contagious.
And I think it's important to realize too. So one kind of stat that always gets me is it's so contagious that if you and I are sitting here in this room doing this podcast, if one of us has measles and we leave and someone comes in this room up to 2 hours later, they could still get infected with measles.
Ooh. Yeah, that's no good.
Mm-hmm.
Right.
That's no good.
Right.
The defense is a vaccine.
That's the best defense for sure. Yeah, no doubt. Very effective. I think 97% effective after 2 doses.
Well, so why did this come back? I mean, that's maybe a question, I don't know, above all of us. But, I mean, if it was eradicated, how come we're here again,
Right.
talking about measles so much?
One of the reasons is because it is so contagious. We need around 95% vaccination coverage to keep measles in a community, to keep measles away. And unfortunately, over the last few years, our vaccination rates are dipping.
So my biggest question when I was thinking about this, because you automatically start thinking about yourself, right? I'm like, did I get the vaccine as a kid? Like, I can't remember. I know my mom doesn't remember. I think so. What do people do? I mean, especially for, folks like me, a little older, like don't remember. Do you get another shot? What's your recommendation there?
Yeah, well, we have pretty consistent penetration of a very effective live attenuated inactivated vaccine since after about 1968. There was a time when only one dose was given up until like the late 80s. But prior to 68, so the measles vaccine first was available in 1963, but in the beginning there was a killed vaccine. There was an initial live attenuated vaccine, which felt not to be as effective. So in the beginning, if it wasn't really clear what vaccine you got between 63 and 68, it was generally recommended to be either boosted or revaccinated. But I think after 68, people did well. However, if you got just one shot, a lot of physicians, vaccinologists, et cetera, would recommend getting a second shot. I think I got my second shot in college, which would have been in the 80s and 90s. So anyway, so that's more than you want to know. But yeah, but basically after the late 60s and certainly after the 80s, I think the vaccine's been very effective.
So the recommendation now is 2 shots.
Correct.
Yes.
Right.
Yes.
Yeah. Yes. First dose usually between ages 12 and 15 months, and the second shot between age 4 and 6 years.
Does the immunity wane over time? So, like, if you got the shot, back in the day, 80s, 90s, when you got it, I mean, what do you think?
I think I would say most people would recommend that if you have documentation of 2 shots after late 80s and the 90s, you should be protected for life. It's very reliable. Yeah.
Live vaccines are very effective.
Right. Now, there are caveats, which we don't have to get into the details or the weeds. In people that become immune suppressed later in life, In certain situations, probably in situations where if you're a healthcare worker or during an outbreak, for instance, for people that are immune compromised, perhaps maybe their immunity can wane, but that's rare, and that's the exception. So I think most questions are around, just like you mentioned, well, I was born in 66, but what happened in the 70s, or what vaccine did I get in 1964? So those are tougher questions. But for most people, after the mid and late 80s, I think if you had 2 shots, it should last lifelong.
And I think what we recommend for people is if they do have questions to definitely talk with their healthcare provider.
Yeah, because there's really no way to find out your status, right?
You can do a titer, however, that could be expensive, and insurance doesn't always cover it. So I think that's why everyone has different circumstances.
Tell me what that is. Is that just testing to see if you
It's looking to see basically the concentration of antibodies in your blood that are directed against or recognized or can neutralize the measles virus.
Yeah, that sounds intense.
Yeah, it's your antibody concentration that recognizes measles. Yeah.
Well, and I've heard you can, check with your school if they're still around, see if they have records of that.
If you went to college in the last, couple decades, because that's a requirement for MMR vaccine.
That's
a lot of work.
Right. And sometimes we can answer questions too at the health department. Either providers can ask, we'd prefer that, but we're always willing to answer specific questions that come up in situations like this.
So obviously your primary care can help you with this probably, but where else can people get a vaccine?
So vaccines in our county, definitely through healthcare providers. Our health department, we offer vaccinations, as well as most pharmacies in town also offer vaccinations. So you could, call your local pharmacist, your local provider, definitely ask them questions about your own situation, and you can definitely always call the health department.
You talked about your concern. So what is Deschutes County Public Health doing now to the outreach, the education, are there clinics, those kinds of things? What's the county doing now to help with this, or to be on the, hey, we need to be ready?
Yeah, so one of them is this podcast. And we are working really closely with our healthcare providers because, as Dr. Fawcett mentioned, many of the healthcare providers right now have never seen a measles case. And so we put out what we call health alerts, and keeping our healthcare providers up to date on what's happening within the country and within our state around measles. If people have suspect cases, they're required to report to public health immediately. So one of our big roles is, working with our healthcare providers in our lab. So if someone comes in and they suspect that it could be measles, they're giving us a call at the health department, and we're helping organize testing, determining if it's an actual case. And then from there, we really kind of hit high gear and start looking at identifying contacts of cases, isolation, all of those factors. And so that's kind of after we have a case. But right now, a lot of it is educating our providers as well as educating the public of the importance of vaccinations. And then we also work really closely with our schools and our school districts. So as some people probably remember, we just had School Exclusion Day in February, which means we're really looking at everybody's records to make sure they're up to date. And if they're not, then, getting them vaccinated prior to going back to school if they don't have an exemption.
I was wondering, Heather, and Dr. Fawcett, you can weigh in here too, what is take us behind the curtain a little bit. If you have a suspected case, what does that trigger? In terms of response and then education or outreach, informing the public, what happens when you go, uh-oh?
Yeah. And we've had some uh-ohs in the past, and luckily they didn't pan out.
Yeah.
But
meaning there was no transmission.
There was no transmission.
Yeah, we've had an active case in Deschutes County before, and luckily no transmission. Maybe part of that was sort of our case investigation, some of the steps we took to ensure there wasn't transmission, but I think we got lucky.
But break it down for me. What happens when you get that individual or person and you're like, uh-oh?
So we have an amazing communicable disease team of nurses who the first thing they would really be doing is working with that healthcare provider to get that individual tested to confirm the diagnosis. And in the meantime, that individual is isolated, usually either at home or in a healthcare setting. And then we quickly will, once we confirm the case, we do an interview with that case to determine during their contagious period who they may have exposed. And as we have just kind of stated, this is so contagious. That can be a lot of people, especially if it's in a school setting or a daycare setting. But we quickly try to identify all potential exposures. And then we work to identify all of those contacts and determine, whether they were exposed and if they are protected or not. So if you are a contact of a case and you don't have your MMR vaccine, then the recommendation would be to quarantine. We all know that word from the COVID days, unfortunately.
Do.
But it's that they stay home and away from people who are for up to 21 days after their last exposure. So we don't continue to expose other people, and we would monitor them for symptoms during that time. So that's kind of how we stop it in its tracks of unvaccinated. Now, if you're vaccinated, you can go about your day. But we really need to try to stop it in its tracks as early as possible.
Like, who are you most concerned about?
Mm-hmm.
Yeah, I think it's those that haven't got the vaccine yet. They're too young. And there are those that really are not eligible for the vaccine. It's a live virus. So those that are really quite feeble in terms of their immune systems often can't get it. And those are the people that tend to get the most sick. It can cause complications in pregnancy. So we're concerned about somebody who's expecting getting sicker potentially. And I think people just, who are older and have other medical problems. So those are the people we really want to protect the most.
I imagine getting out timely and accurate information is top of mind for public health. How do you do that? I mean, this podcast, great, huge listening audience, by the way.
All right.
But not bad. But how else do you, the community as a whole, how do you get that out? How do you get the word out? Like, hey, pay attention, and here's what we want you to know, and, here's where you can get your vaccines. Here's where you can learn about. Is there a mechanism that people can get that information directly from public health?
Yeah, I think there's multiple mechanisms. We definitely have information on our website. And as Dr. Fawcett said, we also have people who are always willing to take phone calls to talk about individual issues. We also have done a lot of different media, local media, working again closely with our healthcare providers on our health alerts. And then if we actually had a case and we're concerned that there was quite a bit of exposure in the community, then that's when we would do a media release and we would let people know, if you were in this area at this time and, you may have been exposed and kind of what to do. So we would definitely be sending out urgent communications if there was a large exposure in our community and we were concerned about the community's health. And then we also work with a lot of our community-based organizations, nonprofits, to really kind of get the word out on this as well as, any other kind of public health threats that we're facing. I think it's important to also kind of work with our partners, such as our school districts, our child care facilities, and our community-based organizations as well.
And I know you guys have an awesome newsletter.
We do. Thank you for
that people can sign up for. It's something they can actually, besides follow our social media accounts as well, because that's pretty urgent. But that newsletter, a lot of important information in there.
Yes, we have a monthly newsletter that goes out to thousands of people that started during COVID, and we've really kept it up of like what is happening right now within public health that we want to make sure people are aware of. So definitely encourage people to sign up for our newsletter.
And they can go to deschutes.org/public health, I think, for that,
to
get to the link to sign up for that. Yeah. Good source of information there. I sign up. It's wonderful. The people who put that together, great job. What are we missing? What haven't we talked about in terms of, measles for sure. You're still dealing with other things too, and still trying to educate people on, on COVID, on the RSVs? I know we're out of flu season, but I mean,
Yeah, we're not out.
okay.
We're still having cases.
Foot in mouth.
Moving that direction. yes.
Okay.
Yes.
But talk to me a little bit about that, because now you're just adding one more thing. How do you guys navigate that?
Yeah, I mean, the flu, unfortunately, we're still seeing cases. It's definitely going down. I mean, another one that we've had a resurgence of is pertussis, or whooping cough, that we've been dealing with here locally as well.
All
and
across
again,
the state, really.
yeah, and trying to protect those infants. So, my takeaway is just vaccines are effective. They've been around for a long time, and
Especially the measles vaccine.
Yes.
More so than pertussis. But they're very effective, and they're much, much better than if you're under vaccinated or not vaccinated, especially with the MMR. I mean, 97% effective after 2 doses, so for sure. So we're still working on that too.
Is measles your biggest concern right now? I mean, like, if I walk into a public health meeting, what's the lead story? What are you talking about first?
I think that's definitely top of mind, preparing for a potential measles case, because as we mentioned, we had quite a few years ago, I can't remember what year it was, we had an individual come here who wasn't necessarily from here, but from a different county in Oregon, exposed a bunch of people. And just that one potential case caused hours and hours and hours of work and preparation. Luckily, we didn't have any cases beyond that, but we're definitely preparing for that locally. And then, as we said, pertussis is still an issue. I don't want to go too much into it, but bird flu, we're still worried about that one. So, I think it's just all of it's on top of our mind. And then, as far as non-communicable disease and issues that we're facing in public health as we head into summer, smoke season. So we're going to be doing a lot of work on kind of how to protect ourselves from smoke and so those kind of things as well.
Yeah, prescribed burning is right. This month, next month, it's quick.
Yeah,
It's coming
I mean,
quick.
and unfortunately, we live in a county and a community where smoke is going to impact us. So what can we do to help protect ourselves? So that's another area that we really focus on as well.
What is the communication like with other experts in your field? Like, Dr. Fawcett, are you talking to other doctors about, what's that conversation like? And are you sharing information back and forth? Is your cell phone blowing up just with things that you're finding out, learning or do you have? Or this is old hat, Yeah.
Blowing up. I mean, there's two important ongoing lines of communication. I think one that we talked about a little bit today is just being in contact with our local providers, especially the frontline providers in urgent care settings or emergency departments or in the hospital. And even with sort of the flu season, and right before that, we had a little bit of a bump in COVID-19 cases, but we rely on them to be thinking about these diseases that are communicable, contagious, especially with things like measles that, we haven't really seen in Central Oregon we've had a few cases sporadic, no outbreaks. So things that are harder to diagnose. I mean, RSV is not that easy to diagnose in adults, for instance, and we definitely have had, a bit of a resurgence in that in adults. So we really want them to be thinking about these cases. And, some of the diagnoses, especially for measles, you can't confirm right away. So we really need our providers to be thinking about the possibility of measles, maybe even right before the rash. With the rash, there's also these tiny little bumps that appear on the inside of the cheek that are white, blue, called Koplik spots, things like that, to be thinking about that. Because we want to start isolating and doing contact investigation maybe a day or two or maybe long before the confirmation of the disease. So communication with our local providers is really important. The other direction, I guess, would be communication with the state health department. We have, very knowledgeable, experienced people in their acute and communicable disease department. They work with us very, very well, and they're very available. And sometimes we even confer with CDC that supports state health departments across the country. So all that's important. I wouldn't say the cell phone's blowing up, but I definitely, I have those numbers in the memory.
Those
so
covered.
I
You got
can
the
always
numbers.
leave a voicemail and sometimes a text.
And I assume you're talking to other public health departments and OHA, Oregon Health Authority as well.
Which is
kind
state
of-
health.
Yeah, state
Yes,
health.
definitely,
Yeah.
definitely. We're all talking. And, and I just want to emphasize that how much we appreciate our frontline healthcare providers because they're crucial to this partnership and diagnoses. And then I would also just encourage parents who have questions, right, about vaccines. I get it. I'm a parent, and there are a lot of vaccines out there. And so just encouraging people to talk to their healthcare provider and their pediatrician, I think, is so important.
I mean, that's probably one of the biggest takeaways of this conversation. I mean, like there are resources, right, for them to get information, whether they have questions about measles itself, the vaccine, they should reach out, right?
Yes.
Their health provider,
Yes.
public health, whomever they can get, right?
Definitely.
I mean, is that one of your overall messages here?
Yes,
For
definitely.
sure. Yeah, having contact with the primary care provider is really critical. So I think people shouldn't be afraid to just come with questions, especially those providers that take care of kids. And so we really encourage that. And then the providers also reach out to us if they have specific questions. And so we want to be supportive to them, but we really rely on them to give us information about concerns they have about new diagnoses too.
Well, Dr. Fawcett, you've been on this podcast now 3 times.
Wow, really?
Yeah,
Oh,
so
okay.
kudos to you for that. So thank you. But I think it goes to the importance of having the conversations about these things and getting the information out and talking about these things. Thank you both for being here. Heather Kaisner, Public Health Director, Dr. Richard Fawcett, the Health Officer for Deschutes County. Thank you both for being here and explaining these things and answering some of these questions.
Thanks for the invitation.
Yes, thank you. I enjoyed it.
My thanks again to Dr. Richard Fawcett and Heather Kaisner for joining us and helping to clear up some of the confusion and concern around the measles. If you have questions about your vaccination status or where to get a measles vaccine, contact your healthcare provider or reach out to Deschutes County Health Services. And remember to follow Deschutes County Health Services on social media and sign up for their public health newsletter at deschutes.org/publichealth. Remember, you can listen to us wherever you listen to your podcasts. You could find us at deschutes.org/podcast. But until next time, please be safe out there.